seen those doctor shows like Grey's Anatomy and Scrubs, but what is it really like to be a doctor? Today I'm catching up with Dr. Tan, a local general practitioner, to find out what the reality of being a doctor is really like.
Jesse?
Dr. Tan.
Hi.
I've got a couple of questions about being a doctor.
Yeah, sure. Let's come through. So how can I help you, Tom?
Well, first off, you're a GP, but what's the difference between a GP and a specialist?
As a GP, you really have to know a bit about everything, and as a specialist, you know a lot about just one particular problem.
So a specialist could just be like a hand doctor or a head doctor.
That's right. Yeah. And it's our job as GPs to coordinate their care and to put the whole picture together.
Okay, cool. And so as a GP, what's a typical day look like for you?
Yeah, so it starts off in the morning. I come in, greet the staff, check my results and to see if there's any urgent results that need actioning straight away. And then I see the patients throughout the day and deal with any walk-ins or any emergencies as they come along.
And so why did you want to become a doctor?
Really wanted to help patients and help people, and that's where I find being a doctor, you can help them the most.
Would that be the most rewarding part of the job?
Yes, for sure. As each patient leaves the room, a little bit happier when they came in, just giving a lot of reassurance.
I mean, you said as a GP, you need to know basically everything. What's the hardest part of the job?
It's really hard to know everything. We see all different kinds of things, from young babies to adults to the elderly.
Is there much work out there for a doctor?
Definitely. There's, especially in the rural areas, a lot of communities out there crying out for GPs.
Is that one of the first things a new doctor needs to do, is to go rural?
You don't have to, but it's often encouraged. It's a really good and varied experience out there.
What characteristics does someone need to be a doctor?
You need to be caring, show compassion, be a really good people's person, and work hard at what you're doing.
And so from school to today, what does someone need to do to get to where you are?
You have to really work hard in high school, do a bachelor's degree, do a postgraduate degree in medicine, and then spend a few years in the hospital as an intern, as a resident, and then you can apply to general practice, do 3 more years of training before you can sit your exams and become a fully qualified GP. And even after that, it's still hard to know everything. So it's about 11 years or 12 years since high school.
And if you could end up where you are, but do one thing differently, what would that be?
I'd do more volunteering in the community, such as working in nursing homes, so you can see the patient side of things a bit more.
Cool. Well, thanks so much for talking to us today, Dr. Tan. So if you like helping people and you're not afraid of a bit of hard work, maybe think about a career in medicine. For more, hit up myfuture.edu.au.